polyendocrine metabolic ovarian syndrome, or PMOS, the new name for PCOS. I do love this change. I do believe it more closely reflects the actual syndrome. However, after reading this global consensus for how they came up with the name with the goal to address the misdiagnosis and confusion around PCOS, I think they did a poor job of addressing a very common misconception about the disease that I see all the time as a hormone specialist and as a patient myself with PCOS. And that is that patients are often misdiagnosed with PCOS because they're not overweight. Clinicians and probably patients have this idea that you have to be overweight in order to have PCOS. I have seen studies linking obesity to 30 to 80% of PCOS cases, a very large range for multiple reasons, which we could get into later if anyone's interested. But as a PCOS girly myself, the most common thing I hear from other providers when I tell them I have PCOS, they all say, you don't look like you have PCOS, meaning that I'm not overweight, have large pimples all over my face, and I'm not balding. When really, shout out to Liz Beth for giving me some nice hair extensions so no one knows I'm balding. And I treat my own face and my hormone levels as a hormone specialist. Sometimes well, sometimes not so well. When in fact, I meet all three criteria for PCOS, even though you only have to have 2 of the 3 to get diagnosed with. That is irregular or absent cycles, high androgens or testosterone levels, and ovarian cysts, or they've also added elevated AMH levels, which I also have. There is no weight that you have to be PCOS. This is all to say that I think we have a lot of work to do to reduce stigma in and out of the medical community around PMOS to accurately understand and treat this diagnosis.